Back to Obamacare. California may expand health care coverage for immigrants. Yes, this is from an Associated Press that's so happy. You can just hear the cheering as you read the story. President Barack Obama's executive order to spare some immigrants from deportation has galvanized Democrats and immigration groups and healthcare advocates in California to make a move for expanding health coverage to a segment of the population that remains uninsured. The president's action excludes immigrants who came to the country illegally from qualifying for federal health benefits. So the state of California wants to pick up the slack. Until some kind-hearted liberal judge overturns Obama's executive amnesty and says, you can't bring them in here and you can't let them stay and not give them health care, which the Democrats are counting on. And they're also counting on shortly after that, what do you mean? You're granting them amnesty? You're not going to deport them so they can stay, they're fine, but you're not going to let them vote? Why, that's cruel. So it won't be long before they're all on Obamacare and registered to vote. I wouldn't be surprised if it happens in less than 2 years, before Obama's gone. Now, AP doesn't mention this, but California's not the only state doing this. But in California has its own policy providing health coverage with state money to low-income immigrants with so-called deferred action that allows them to avoid deportation. Immigrant and health care advocates say that means Obama's executive order will enable hundreds of thousands of low-income immigrants in California to apply for Medi-Cal, which is California's version of Medicaid. Medi-Cal is a health program for the poor paid for by the federal government and the state. It has grown by about 3 million people in California under federal health care reform. You like that? We reform it and it grows. Yes. Now covers more than 11 million Californians, 30% of the state's population. 30% of the state's population. And by the way, there's a story on Drudge that more and more people in America are going without any health insurance at all. They're allowing theirs to drop, and they're not because they can't afford it, even with Obamacare. More and more people dropping health insurance because they can't. Now, that's not what was supposed to happen. Remember, premiums are going to come down $2,500. You're going to be able to keep the plan you liked. You are going to be able to keep the doctor you liked. What is this? People dropping health care coverage because they can't afford it. It was supposed to be just the exact opposite.